Hello everyone. So in this video today, I will be discussing about how we can enhance the quality of mental wellness through homeopathic medicines for the patients who require palliative care. Palliative care is an approach that improves the quality of life of the patients and their families facing the problems associated with life-threatening illnesses through the prevention and the relief of suffering by means of early identification, impeccable assessment, and treatment of pain and other problems, physical, psychological, and spiritual. Palliative care is not just focused to the patient but also for his family members. Palliative care is total care of the patient and his family members. Now, palliative care starts even before the diagnosis and extends even after the death of the patient, taking care of the bereavement states. Palliative care is person oriented. It means that it just focuses on the person as a whole, whereas curing is disease oriented. It is basically the total care. Palliative care can address a broad range of issues, integrating an individual's specific needs into the care, including physical, psychological, social, spiritual, and intellectual. Basically, it deals with holistic approach, holism, that is interrelationships of the biopsychosocial spiritual dimensions of the person. The whole is greater than the sum of the parts. The individual is a unitary whole in mutual process with the environment. We are not just talking about the disease, but we are dealing with patient as a whole, taking his total care during all aspects of physical, psychological, as well as social and spiritual, because that is what makes up a person as a whole. Now we talk about mental wellness in palliative care. So, what are the social issues faced by the persons having life-threatening or terminal illnesses who require palliative care? So the problems can be psychological, psychiatric, social, spiritual, religious, existential, cultural, ethical, and legal. So there are various aspects in the psychological domains in palliative care. Psychological aspects seen are like the person can be very much anxious, a person can be depressed, hopeless. So we have to be a very keen observer, and we should have a listening ear. That is most important for a physician, and that helps in the counseling, that helps in a relief for the persons facing these problems. So these are few of the psychological symptoms or feelings faced by a patient requiring palliative care. Like the person can be fearful, anxious, facing a denial, depressive, then anger will be there, it can be neglect, it can be a feeling of isolation, and so much more at a deeper level. Then social issues can be that person might think that what will happen after him, who will take care of his family when he goes, what will be the future of his loved ones around him. Then there are so many spiritual things which are around that, like a fear of what happens after death, sense of connectedness, loss and grief, religious aspects, etc. Cultural background also influences that how patients make the pain and palliative care decisions. Some cultures place a substantial value on the community, while others encourage individual independence. Some let the family to take the decision, and while others help the patient to take their own decision. So there are cultural aspects also. Now there are also issues like stress and burnouts for the family and the patient. Burnout is basically a state of physical, emotional, and mental exhaustion that will be caused by too much of chronic stress. This makes the caregiver less productive and sucks the energy also. Now, burnout happens when a caregiver feels help is unavailable and he tries to do more than energy and resources to manage that. Then, caregivers who are burned out may experience symptoms like fatigue, stress, anxiety, guilt, depression, etc. They may have a feeling of loneliness, of being unsupported or being unappreciated. So, these are few of the psychological aspects we can see. Then the demands on your body, mind and emotions can take over, which lead to that fatigue and hopelessness. Then if this burnout remains unattended, it also affects the health of the caregiver. Some caregivers may also feel guilty if they spend time on themselves rather than on the ill or elderly loved one, because if they are fatigued or if they are they are exhausted and they are not able to spend time with a person who is sick, they may feel a feeling of having a feeling of guilty. So, but many times the symptoms are not recognized by the caregiver and it eventually affects the health of the caregiver. Some common signs and symptoms of caregiver stress can be anxiety, depression, fatigue, loss of energy, lack of interest, body aches, pains, headaches, and so many weak immunity, impatience, feeling of isolation, and etc. and so on, like I have mentioned all in this slide. Now, what is the role of homeopathy in palliative care? Now, homeopathy has been known for its benefits in a number of physical ailments, but very less people know about its goodness with regard to its role in mental health. Homeopathy has a great role in mental health related issues and the diseases which are related to mental health. Similar to palliative care, homeopathy adopts an individualistic and holistic approach. Mind, body, and life force relationship. We treat the person who is sick rather than treating the disease suffered. A homeopathic doctor does not treat in the name of the disease. Rather, our treatment is targeted against the patient who is suffering from the disease. So it's basically a total care involving physical, psychological, social, spiritual aspects, taking the individual as a whole. Individualistic approach is adopted in homeopathy. Then holistic care is taken as a main target of treatment in homeopathy. Homeopathy gives great importance to mental health, both in the treatment of physical also and the mental illnesses also. Now, homeopathic understanding of health is related to mind in general also. Then they generally assume that body and mind are dynamically interconnected and both directly influence each other. So it's not just the mind or the body individually, but we deal with that dynamically interconnected with each other. Homeopaths base virtually every homeopathic prescription on physical and the psychological symptoms of the sick person, and psychological symptoms often play a primary role in the selection of the correct medicine. Then health is considered a perfect state of harmony. This disharmony can come from dysfunction in any of the one, like it can the disharmony of the mind, body or the life force can be due to dysfunction in any of the three. mind, body, or the life force. Holistic health care believes that a dysfunction in one affects the whole person and not just that one part of the body. If one of the three is affected, it is the individual who is affected as a whole. It is not the dysfunction of any one part. Holism promotes that human beings must be treated together to achieve healing rather than simply treating a person for a specific illness. Holistic health looks into the need of the sick and provides customized care, understanding the patient in the individualistic way, and the treatment is oriented in an individualistic way accordingly. Now, many illnesses, even in palliative care, are also psychosomatic. Psychosomatic ailments arose as the man became civilized. When civilization took place, mental stress and pressures got increased. Now, these stresses can be sudden shock, grief, insult, constant stress, pressures at work, financial problems, and so on. These mental stresses led eventually to physical troubles such as acidity, constipation, asthma, ulcerative colitis, skin ailments, etc. So, mental stresses led to deterioration of the physical health. Now, homeopathy treats these very well because it treats holistically, taking mind and body as a whole, as seen in the psychosomatic ailments. Single medicine administered on the basis of similia takes care of the whole. Now, along with this, patient needs to learn how to handle stress also, because that is also very much essential to bring about cure and to maintain a healthy state. So, we can say that homeopathy is a very good modality for anxieties due to different causes like fears, anger, behavioral issues, intellectual issues, temperamental issues, intoxications, and so many other mental illnesses. Now, all these can be well managed through homeopathy. We take a case, we do a case taking, a detailed case taking is done to explore these causes. Now, causes can be sudden fears, shock, accident, anxieties, guilt, anger, and so on. Now, definitely if a person has these issues, our defense mechanism surely tries to deal with these, but is not able to cope up. These emotional causes deviate our psychoneuroimmunology and make us sick eventually, and we end up into having chronic illnesses. Now, our medicines help to cope up with these in an individualistic manner. For example, each person has his own kind of anxiety, which has its own specific origin, evolution, and outcome. So, a single homeopathic medicine is administered, covering the characteristic symptoms of each individual patient. And along with this, psychotherapy and a talk with the family members of the patient is also essential. A homeopath seeks to find a medicine that matches the totality of the patient's physical and psychological symptoms, irrespective of which came first. These small mental or emotional issues, if tackled at an early stage, at the earliest, they will prevent future illnesses. Our medicines are so much powerful and effective that if these issues are tackled at the earliest with our medicines, they will prevent any future illnesses. Now, there are so many medicines for mental ailments in homeopathy, and the selection of medicine, its potency, dose, repetition is decided through a process by a homeopathic physician, and it is all based on a detailed case taking. The selection of the remedy is based upon theory of individualization and symptom similarity definitely using a holistic approach. Now, apart from medicines, psychotherapy provided by a homeopathic physician has a great role for the cure of the patients. A good homeopathic doctor listens, sees, talks, understands his patient. So, our treatment is based on observing physical symptoms, mental symptoms, and the peculiar characteristic symptoms in each individual patient. By this way, a state of complete health can be regained by removing all the signs and symptoms from which the patient is suffering. The aim of homeopathy is not to treat the mental problem, but to address its underlying cause and the individual susceptibility. Then, using homeopathic remedies for palliative care is entirely safe and free from all side effects, even on long-term use. Our medicines do not interact with any drug treatment and can be integrated with allopathic medical regimens. And homeopathy can be offered as a modality option for all hospices even. Then, role of few homeopathic medicines. Now, our job, first of all, when there is a dying person and he has a difficulty in breathing, so first thing is to speak gently and lovingly and use a gentle reassuring touch to ease the fear. Do not panic. Don't create any panic because this can increase the fear that may be already present in that dying person. It is possible and beneficial to enhance the emotional balance of the dying person and their loved ones as they go through the stresses and stages of grief surrounding death. Then we come on to the medicine part. So, a person's pain may also be reduced greatly by treating their fear, grief, or anxiety. Now, of all the remedies known for helping a person, a medicine known as arsenic album is known for soothing the fear of death and is indicated when there is agitation, restlessness, thirst, anguish, internal burning with external coldness and desire for warmth. These are just a few symptoms. We give the medicine as per the totality and the individual symptoms manifested presented by the patient. If there is acute fear and panic, then and the patient is saying like he is predicting the time of death that he may die at this particular moment, then equinite nepellus can be another medicine and its doses can be repeated as often as 10 minutes to relieve his fearful feelings. It is the best remedy when there is panic state which has gripped the body and the mind and the heart is racing and the mind cannot relax itself away from the distressing thought pattern. They may have a look of fear in the eyes and the person might be very much tensed. That is noticeable in the appearance itself. Now, another medicine, coffea, can help in cases of insomnia. Then arsenic can also help those who are not able to sleep due to fear and worry. Then ignatia also helps a grieving person in sleeping. Then another medicine, califos, which is known to be a tonic for the nervous system, can help the caregivers who are feeling tensed, stressed and overwhelmed. They may give response like muscles relaxing and stress releasing. People can take them often like 4 to 6 times a day in a 6x potency and they get physical as well as mental relief. Now, in these circumstances, we end up facing the loss of a loved one at some point in our lives. Some losses come suddenly and shockingly, others may be unexpected or expected. So, but in these instances, the feelings of grief and sorrow can be very, very strong. When these feelings start to overwhelm, our medicines can bring healing for the dying person as well as their loved ones. Ignatia is one medicine which can be used during this acute phase, initial phase of grief, immediately before and after death. It is called a funeral remedy and it can be given as soon as possible. It is good to give it as soon as possible. Then another medicine is cocculus. When there is an effect of cumulative loss are known to be especially trying when spouse, family and friends are lost and loneliness takes over. So cocculus is known to help those who have been caretakers of the sick and now have grief and health problems. Another medicine, acid falls, is for grief when there is very low energy and debility of the nervous system. Now, also along with the medicines, there is a role of counseling and communication. Basic counseling is through case taking and it is a talking therapy. It involves listening, providing support, helping the patients and their caregivers in whichever way possible. Then they range from a single session to multiple sessions also. Now, our role as a physician is to make the patient or carer comfortable, establish communication, listen to the difficulties, feelings, and emotions, then ask about their worries, and we should not be judgmental. Now, look for the symptoms of stress, burnout, mood change, etc. So, we should listen with the heart and not just the ears. We should look out for the symptoms and give an appropriate remedy. Now to conclude, I will just say that homeopathy has an answer to any kind of psychiatric or psychological ailment. It can be adopted as a modality for various issues related to mental health. Now sweet changes can be made with these sweet pills. Homeopathy can treat right from the finest origin of the ailments itself. Diseases which are incurable can also be treated in homeopathy. And there are many things that families can do to soothe and bring comfort to their loved ones without pharmaceutical intervention or alongside of drugs. Healing does not always mean curing. Sometimes it means helping the patient to prepare for death and to enjoy the last days of his life. Compassionate end-of-life care ensures that they can spend their final days meaningfully and in an environment and amongst people they know and love. Thank you so much for watching. I hope you liked my video.